Well, good afternoon, everyone. My name is Peter Tatian, and I am a senior fellow in the Metropolitan Housing and Communities Policy Center at Urban Institute and the research director for Urban Greater DC. And I will be the moderator for today's event in the Revitalizing and Reimagining the DMV After COVID-19 series. Before we begin, some quick housekeeping. This event is being recorded and the recording will be posted online afterwards, so you can watch this event again or share it with others. Speaker biographies are available online at urban.org, and a link to the bios will be posted in the chat. We have closed captions turned on. If you'd like to adjust your settings, click on the live transcription button at the bottom of your Zoom window. All participants are muted, but you can send questions or comments in the Q&A box at any time, and we hope to have enough time for audience questions at the end. We also have a 1 to 2 minute survey that we will ask you to complete at the end of the event, so a link to that survey will be shared in the chat. And finally, if you tweet about the event, please tweet using the hashtag #LiveAtUrban. The DMV is one of the most diverse regions in the country, but decades of systemic racism and discriminatory practices have produced significant inequities in education, income, employment, housing, and health for people of color. For example, in 2019, Black and Latinx residents in our region had a median household income of around $80,000 compared to $130,000 for white residents. And Black and Latinx communities had more than twice the poverty rate of white communities. These disparities reflect deliberate racist efforts to prevent wealth building and opportunity for certain populations. The COVID-19 pandemic has also disproportionately impacted people of color throughout our region, and again, because of these ongoing and historic racial impacts. In every community across the DMV, Black, Latinx, and Asian residents bore the brunt of infections and hospitalizations, job and income loss, and are now being vaccinated at rates much lower than white communities in the region. In response to these ongoing and growing inequities, the Metropolitan Washington Council of Governments formed the Chief Equity Officers Committee, comprised of the lead racial equity officers from each of the local governments. This council is designed to serve as a hub for these leaders to collaborate and coordinate their efforts on advancing racial equity initiatives throughout our region. So today we're very privileged to hear from 3 chief equity officers from across our region who face the difficult but critical task of remedying centuries of discrimination and empowering affected communities. So today I'm very honored to be joined by first Carla Bruce, who is the Chief Equity Officer for Fairfax County, where she designs, provides overall management of the One Fairfax strategic framework, advising and supporting the Board of Supervisors and county leadership and staff in shaping and directing policy and practice to foster equitable opportunity for all Fairfax County residents. She also serves as the chair for the Metropolitan Washington Council of Governments Chief Equity Officers Committee, and has over 25 years of local government management experience. Dr. Amber Hewitt is the Chief Equity Officer for the District of Columbia, where she works in collaboration with district leadership and agencies to apply a racial equity lens across government operations. Dr. Hewitt previously served on DC's commissions on fathers, men, and boys, and worked as the Director of Health Equity at Families USA. She began her career as a tenure-track professor teaching undergraduate and doctorate level courses in psychology, social justice, multicultural counseling, and diversity issues at the University of Akron and Loyola University Chicago. And finally, Tiffany Ward is the Chief Equity Officer for Montgomery County, where she is charged with training county staff on the core tenets of racial equity and examining county policies and practices for their short and long-term effects on racial disparities. Tiffany has spent more than 20 years creating a more fair and equitable world for people of color. 15 of those years have been spent in local government, focusing on education, health and human services, and housing policy. She serves as the vice chair of the COG Chief Equity Officers Committee and began her career in the labor movement on voting rights issues, including re-enfranchisement and voter protection campaigns. So I'm very delighted to welcome all three of these dynamic leaders to our discussion today. And many people on the call today may be wondering, what does a Chief Equity Officer do? And you are all some of the first individuals to serve in these roles in your respective communities. And as I mentioned, you're tasked with helping to solve some of the glaring inequities that decades of intentional policy and decisions have created, which is certainly no small task. So I'd like to ask each of you to say a little bit about how you see your role as Chief Equity Officer in transforming your communities. And I will start with Ms. Carla Bruce.
Thank you, Peter, and to your colleagues at Urban for the invitation to participate today and to be in conversation with my colleagues, Amber and Tiffany. I would start by saying that the role of a Chief Equity Officer has no one definition. I think it's ever evolving. And while there's some core elements, it can be and should be a role that uniquely fits the community that it serves. So I'll speak as the Chief Equity Officer for Fairfax County. And in that role, I am, like you said, leading the county's efforts around One Fairfax and really fulfilling the commitment expressed by our Board of Supervisors when they adopted the One Fairfax racial and social equity policy. So in a nutshell, that policy states that the county will consider equity in all of our planning and decision-making, and especially in relation to 17 areas of focus that are outlined in the policy. So to do that, my role is to build our organizational capacity and infrastructure with our leadership, both elected and executive, with our staff, our boards, authorities, and commissions, through strategic planning efforts and also through training. And I think of that as really the inside work. But I think the role of a Chief Equity Officer is about inside and outside work. And so while in the inside, it's about building understanding and really building the will within our organization to move beyond the sort of political forces that might keep things the way they are, that might maintain status quo. On the outside, it's really about organizing and movement building and really seeing this role as what I've heard somebody call it, being a bureaucrativist, right? So my role is really to align the efforts of the county, not just to what we talk about and plan about inside, but really what's sort of in response to what the community is demanding of us as a result of this commitment we've made to advance equity.
Great, thank you so much. Let me turn next to Dr. Amber Hewitt to say a little about how you see your role.
Well, thank you. I also want to thank Urban Institute and Peter for you moderating and to share the virtual stage with Carla and Tiffany. I've been in my role for a little over 4 months, so I've had the benefit of gaining wisdom from Carla and Tiffany and learning from their work. I also want to give a shout out to Dr. Brian McClure, who's the director of the Council Office of Racial Equity. So my office sits within the Office of the City Administrator, and it was established by Mayor Bowser earlier this year. And similar to what Carla mentioned, focuses on developing an infrastructure to ensure that our policy decisions and district programs are evaluated through a racial equity lens. And similar to the previous remarks on the inside work and the outside work, my office is responsible for collaborating with district agencies, residents, as well as external stakeholders. And even though we're some of the first in these positions, we aren't the first in advancing racial equity in government. And it's also important to acknowledge what I call our local racial justice warriors who do this work daily directly in impacted communities. So I see my role and the vision of the office as one that builds upon the mayor's priorities, as well as existing agency strategies and goals. And it's not about me, it's not about my vision, it's about a collective vision, and one that prioritizes the needs of those that are most affected by racial inequities. When I think about that collective vision, I think about the importance of acknowledging the cumulative and ongoing impact of historical trauma on communities of color, namely Black people living in the district, as well as acknowledging the intersections of race and other social categories or experiences, as well as analyzing which communities will benefit and which communities will be harmed by our policy decisions, and then finally making sure that we're targeting solutions and distributing resources to residents that have experienced systemic and institutional oppression.
Great, thank you so much. Tiffany, can you please share a little bit about your thoughts on this?
Sure. I don't know if I will, if I can add anything new to what both Carla and Amber said. I think both of them really captured what's going on here in Montgomery County as well. We have a very prescriptive legislation that really lays out what my job is as a chief equity officer, right? So my job is to build the infrastructure like everybody else that enables all of our employees to be trained on the tenets of racial equity, as well as to examine all of our policies, procedures, and practices for their racial equity impacts, right? And I think that Carla captured it perfectly when she talks about the inside-outside game. So that's the inside game, that really is, and that's a rather large task for most of us, pretty small staff. But it is incumbent upon all of us, right, in doing this work, and if we're going to do it well and do racial equity in process, to uphold and to uplift the communities who work and live outside or within our communities, but outside of kind of the government framework. So if we are not doing that, then I don't think we're really getting to the nuts and bolts of what racial equity is, right? How are we making sure that the voices of the people of color, Montgomery County, Black, Latino, Asian, and largely the poor people, many of those people poor, how are they getting to the table? Are they really have any power once they do get to the table? Are they just tokens? How do we examine our processes? And so in such a way that we're really uplifting those voices. So I see myself as kind of a thought leader when we think about not just how we are doing that work, but who we're doing that work with, as well as someone who's building capacity. We are a pretty small office. And so in our job and our charge is building capacity. We want to make sure that we're not the only people within the county and city governments, for the case of Amber, who are lifting this up. So I take that charge pretty seriously. And so that everything that we do, right, we're thinking about the implications for Black, Brown, and Latino people in our communities. And nothing is kind of arbitrary or lost, and without their voices being included. So I hope I added some value to that one.
Oh, absolutely, you did. Thank you. And I think that the theme of the inside and outside that you and Carla both touched on is something I've heard very commonly discussed. I mean, we talk about it at Urban in terms of our thinking about racial equity, but other organizations as well thinking about how those two things need to be part of the story. So thank you all for sharing that. You're of course taking on these tasks and these responsibilities at a very unprecedented time in our country and world's history. Many of us had hoped that we had passed the worst of the pandemic, but of course, unfortunately, we're seeing a rise in cases in the US and in our region, even as some of the pandemic era protections were starting to be winded down, and now some like masking are coming back. I'd like to know how you think about, this current situation, the ever-changing situation with the pandemic, how that impacts the work that you're doing. How do aspects of the pandemic and recovery present threats to achieving the goals that you're trying to achieve, or are there ways in which maybe that it creates some opportunities? And let me start this time with Amber, if you want to take the first guess at that.
Sure, and I think when it comes to the pandemic, we can't just focus on health outcomes. We have to look at both the social and structural drivers of health. And I think what the pandemic has taught us is that all of the issues that we work on through a racial equity lens are impacted and will be impacted. And that when we look at the disparities in COVID-19 health outcomes, that they stem from health inequities that are rooted in systemic and unjust social and economic policies. And I remember at the very beginning of the pandemic, when we were looking at who was most impacted, a lot of the conversation centered around the link between pre-existing conditions and the higher rates of pre-existing conditions in Black and Brown communities, and how that contributed to health inequity. And I think that's a very narrow way to look at the trajectory of health inequities. And you have to look at how the differential rates of those chronic conditions came about in the first place, how exposures such as community trauma, neighborhood disinvestment, environmental toxins, how all of those things are exacerbating those conditions, and how those in turn are even more affected by inequities in political power and economic opportunity. So we have to look at this, we have to widen our lens when it comes to health equity and racial equity. In the district, DC Health, they're definitely looking at this through the lens of equity and health equity and those larger structural drivers, campaigns on educational campaigns on the vaccine, but they're also looking at 5 pandemic outcomes. So I think part of your question was around what are the greatest threats and the greatest opportunities. So what the DC Health Department are looking at are the impact on preventative and chronic diseases, what are the long-term impacts of COVID-19, and the economic and job loss. And we know that the data show that those who are most impacted from the health standpoint, from the economic standpoint, are Black and Brown folks in the district. So we have to think about all of that, and also the impact on our mental health, the increase in mental health. I'm a psychologist by training, the impact on trauma, grief. Students are about to return to school. So I think we are currently tackling those tough questions and making sure that our policies and recommendations center, not only just include those voices, but really including the voices of those most impacted in the decision making will be critical moving forward.
Great, thank you so much. Tiffany, Carla, would you like to add anything to what Amber said? Any other thoughts on that question?
Yeah, I would just add, I mean, we hear lots of people use that phrase, build back better. And I think it's something we would all agree with, but the question is, are we? And how would we know if we were? So I think that, knowing who was most disproportionately impacted and targeting our strategies around those who were most disproportionately impacted is really important. So Amber referenced this, this is a public health crisis, but it's driven by structural inequity, and it manifested itself as a public health crisis and an economic crisis. And so one of the things that I just wanted to point out in Fairfax County, we developed an economic recovery framework and action plan. And it's really focused, as you would expect an economic recovery framework to be focused on the retention of businesses and workers, on mitigating the economic impacts of the pandemic across industries. But it's really also very intentionally aimed at positioning the county for what the framework refers to as a just and resilient recovery. And that piece about a just and resilient recovery, really with targeted investments and programmatic adjustments that are focused on those who were vulnerable to begin with. Because again, something else we've probably heard a million times is that the pandemic really laid bare the inequity. The inequity was present before the pandemic. What the pandemic did is show anybody that might have doubted that how present inequity is in our communities. And so, really focusing our efforts on those folks who were already vulnerable and were particularly impacted as a result of the pandemic, whether that's a population, a specific area, or certain types of industries. And I think that, carrying that perspective of being having this just and resilient recovery is a theme that I think is really important, and one that is very much in alignment with this focus on becoming one Fairfax.
Great, thank you.
I guess I'll add very briefly that really, I think when you talked about whether or not this has been a challenge or opportunity for our work, I really see the pandemic as an opportunity for our work. Much like Carla said, it really did lay bare for any doubters in this work that racial inequities were either not true or somehow not as pervasive, right, as we know that they are. We know that these inequities are across health, wealth, well-being. I thought about the digital divide the second the pandemic hit and schools closed, right? And so when we think about how we're going to spend resources, and we have to make our case within our communities for how we're going to spend resources and close these disparities and many gaps, I think the pandemic really helped us to make the case for spending more of our human resources and our capital and fiscal resources to do what needs to be done so that our whole communities are not vulnerable, particularly on the public health side. We put a lot of time, money, and energy into the pockets of our county that had higher rates of COVID, right? And those pockets are communities of color because they are most likely to be working during the pandemic. We know that, you know, those were the folks who were delivering your groceries, who were still working at grocery stores, who are still working at pharmacies, right? So they are more vulnerable to being susceptible to catching COVID. And so I think for us, it was yes, a challenge, but absolutely an opportunity as we start to make decisions, resource decisions within our county. And I think for those who had any doubt, it helped us make the case that this is the right place for us to be spending our time and our fiscal resources right now.
And I do think we have to acknowledge that there's an unprecedented investment of resources, right?
Absolutely.
So we have the resources that we already had access to, but these resources that are being made available from the federal and state.
Yeah.
It's not about just responding in the emergency, but being strategic and getting at root causes so that those people that were vulnerable, we're getting to the reasons why they were vulnerable in the first place and not, you know, frankly, wasting this opportunity with Band-Aid solutions.
Absolutely. And I think the county, in Montgomery County, we are working with our department heads as well as our council on looking at ARPA proposals. So that's American Recovery Act proposals for their impact on racial equity, and hopefully looking at programs that are far reaching, that go deeper, that are not just, and we services are necessary, right? But that are not just services, but that really start to get to some of the systemic issues, particularly around health, around wealth, around digital divide, and housing, quite frankly, in our county, in our region.
And I completely agree that a root cause analysis is very important, and capitalizing on the opportunity of having long-term impact. If we're only thinking about, right now and the immediate impact, we aren't going to get any closer to closing racial equity gaps. Also want to make one other comment that I was inspired by Carla, the just and resilient framework. And I think it's important when we're thinking about designing policies and programs to think about the inherent strengths and assets that are in communities that are also, those are the same communities that are most often marginalized, but they also have strengths and assets that we can build upon. And I think that that's critical to include in our racial equity lens.
Great, thank you all very much. I think this is a great lead into my next question. Because many localities are either wrapping up or in the middle of their budget planning process for the next year. So of course, where we spend money, as you all said, is very critical piece of whether we're making a priority of some of these equity issues. And there have been, some changes I think that we've seen. And, as one example, the DC Council recently voted to raise taxes on wealthy residents to increase funding for homelessness and other social programs. But how would you all see, what kinds of things would you like to see local spending ways in which should be invested to invest equitably in residents' short-term relief and long-term prosperity. What types of things would you like to see that money used for? And let me start with Tiffany.
I think I'll speak first to the Montgomery County mandate. So our racial equity legislation actually requires that my office help the rest of the county government evaluate all their budget decisions with a racial equity lens. That means that we must look at every singular, both current and forthcoming program and policy, right, with a racial equity lens in its budget. And so to that end, we have created a racial equity tool that really helps departments ask questions about how they are evaluating their programs and processes for racial equity. It asks them what disparity they are actually targeting, if they are targeting a disparity, what data they're using, and that's both quantitative, meaning the numbers, and qualitative, right? So who have you talked to in these communities? How have they expressed their needs? How is this showing up for them in the day-to-day, right? And then how are you using that data? How are you using it to then inform how you are making this particular budget decision? And then how do you think this budget decision is going to impact this particular gap or disparity? And so we're required to do that for both our operating budget and our capital budget. And we just finished, or we're in the midst of our capital budget right now. And so it's interesting. I think folks are finding it to be a challenge right now, but the point is to really have people not be able to go through a budget cycle without thinking about this. This shouldn't be an afterthought. You should be thinking about this on front end of all budget decisions, right? It really isn't. How can we like mitigate, what do I want to say, harm? How can we not cause the harm, right? How can we think about these communities and these often neglected and quite frankly, historically oppressed communities firsthand? So that's what we're doing to build that into our budget processes. Yeah, I think I'll defer to both Carla and Amber on what they think are new processes or programs.
Yeah, so that sounds like a wonderful process. I can see how it's challenging, but that's a fantastic process you described. Yeah, so Amber, Carla, any things you'd like to add?
Yes, I'll jump in briefly. I'm actually just recently consulted with Tiffany and her team on that tool because we're in the process of developing a tool for the FY23 budget that will ensure that budget decisions budget decisions are evaluated through a racial equity lens and answering those critical questions. So we're in conversations right now on what that tool would look like with our budget team. As you all know, the mayor's FY22 budget council just recently voted on that, and the district received, $2 to $3 billion in direct federal relief. So this is a significant opportunity, and the budget is a powerful lever to advance racial equity for all residents, and it does make critical investments that promote racially equitable strategies. I am looking forward to the tools that we're creating for FY23. So it will be that infrastructure will be built in. Those questions will be there to guide agencies to assess how their budgets benefit or negatively impact communities of color. So we're looking forward to launching that soon. And I just kind of want to double down on what Tiffany said. In order to answer that question, we have to draw attention to the racial inequities and understand the data, analyze the data, and listen to community before budget decisions are made.
And I would just add, Fairfax County too is in the early stages of incorporating an equity perspective into our budget process. But I will say that based on what the data already tells us and what we already hear from the community, our Board of Supervisors has made significant investments over the last couple of years in two key areas of inequity: housing affordability and childcare. So again, these are issues that we know, we have data that would suggest that there are already inequities there, not having enough housing and not having it affordable and accessible to folks, and then how we are approaching where our affordable housing goes, making sure that it's connected to the opportunities that do exist in Fairfax County. So I think the incorporation of equity in our budget development process right now, it's really focused on those things that are new, but eventually will be considered into, as Tiffany said, through everything. So into our baseline as well. But wanted to just point out that even as we build out that process, we have existing information and existing data that can help us to make some informed decisions. And for Fairfax County, that's really led us to make greater investments in housing affordability and childcare.
Great, that's wonderful to hear. Thank you. Let me remind our audience that at any time you can type your questions in the Q&A box, and in a few minutes we hope to get to as many of your questions as we can. But let me ask another question of the group. So systemic racism and racial inequity are obviously very complex and deep-rooted issues, and the results of change are not always going to be immediately visible or easy to quantify. So let me direct this first to Dr. Hewitt. How do you think about defining success for your community and the work you're doing? How will you know you're making progress towards these ambitious goals that you've been tasked with?
Mm-hmm. Well, I want to start by saying I'm interested in understanding how community defines success, how those most impacted by racial inequities define success. I try to be humble in everything I do and not assume that I know all the answers, which I don't. So we will be launching stakeholder engagement processes for what we're calling a racial equity indicator project, where we will collaboratively with district leadership, those most impacted by racial inequities, and coming up with what are our district-wide racial equity priorities, and then what are the indicators underneath those priorities that we will set baseline targets and track over time. So we're in the process. We'll be launching that project very shortly. And the ultimate goal is to develop an actionable outcome oriented measurement and data strategy that will result in the acquisition of DC's first racial equity dashboard. So that's one way that we'll measure success at a district-wide level. And currently, agencies, now that we've wrapped our budget, agencies are developing their annual performance plan. So I'll be working with agencies to develop initiatives around racial equity, setting key performance indicators directly tied to their specific line of business. So we'll be looking at success from two levels, at the district level, and also measuring success through annual agency performance plans.
Great, thank you. Carla, Tiffany, any thoughts about how you're tracking success?
I'll jump in real quick. I think Amber hit the nail on the head when she talked about, firstly, talking to the community about what success looks like for them. So for me, I think the first thing I thought about was are people better off, right? Are people better off? And I think if we are not talking to folks about whether or not they are better off, then we've probably just been spinning our wheels and causing a lot of stress and strain. And so I think that's why her answer on the community engagement piece is really important. Like, we have to center this work in the communities that we purport to help. We purport to be working on behalf. And so, to that end, really a lot of what we are doing is trying to embed a community engagement process within our departments, within our county government overall, and to transform some of those community engagement processes so that they are collaborative, that we aren't just asking people, 3 times a year what they need. And then, quite frankly, extracting a lot of time and energy from communities of color, and then giving them little of what they've asked for, what they need. And so I think one of the ways that I feel like I will know that we are getting towards where we need to be, if those processes have been changed, and if the communities that have oftentimes been locked out feel like they have some power once they get to that table. So that's one of the informal ways I feel like I will know, or we will know, whether or not we're actually making progress.
So Peter, I just want to, I do want to make this point, and I 100% agree with both of my colleagues, but speaking on behalf of chief equity officers, and I will say that these roles come with some pretty high expectations. You could say that the challenges we're facing, and I've heard people say that, and I agree, it's taken us 400 plus years to get into this mess, right? So while it shouldn't take another 400 years for us to get out of it, it's not going to happen overnight. It's not going to be easily measured through a set of indicators or a dashboard. And it's also not going to happen solely through the actions of a chief equity officer. So you've heard these women, they're brilliant, right? So we're good, but, and that's, again, not to say that metrics aren't important, they are, but we cannot fall victim to the dominant culture's belief about measuring things, right? Improving that we're making progress through quantifying them, and this belief that if something can't be measured, then it must not have value. And I fear that, that if we don't call that out as equity officers, that we are going to subject ourselves to something, I think some unfair accountability. Should we be held accountable in these roles? Absolutely. But let's go back to when we talked about what the role of the chief equity officer is, and it's about outcome goals, but it's also about process goals and performance goals and ensuring that these infrastructures that we are building are complete and they are working, and that the actions that we engage in, our process and our performance is tied to the outcomes we're seeking to achieve. Gathering data, particularly baseline data that tells us the as is, where we are now, is really important, right? Because that is what's going to inform and direct our actions. But that data should not really be looked at from solely an outcome perspective, because I think that is an unfair use of that framework, right? An unfair use of data and indicators. It's important to tell the story, but in terms of measuring our progress, there is a lot of work to do. And this is work that has to happen within and across government. This is work that has to happen in the private sector that's really going to shift the outcomes in the direction we would like to see them. So anytime I get a question about, well, how are you measuring your progress, right? I got to take a deep breath and say that, we're focusing on that, but I got to call you on it because it's not, let's not fall victim to, this, relic of the dominant culture, right? We have to be focused on, as Amber and Tiffany said, how the community defines what success looks like, right? And use as one of our indicators, are we fully engaged with the community, right? That's about process. That's how we do it, not just what we do.
If I can ask for 30 seconds, Peter, I promise I'll be ready to go to the next one.
No,
I just want to build on what Carla said. And I've been thinking about this literally since I got this role. That this work in this particular role is not the panacea to racial equity in this country. Like, I want people to understand that this is not the one and only way to get there. That we are really, we should adopt a yes and kind of attitude. It's yes, we should have racial equity offices, and yes, we should continue to have legislative and budget decisions and all other kinds of resources that move us towards a racially equitable society. So this is not a place where people come to outsource their responsibility in moving us to a more just and racially equitable community, world, particularly because, like she said, this is a process. This is process work. Right. And so we know that process work takes time. It's systems work. But there are I'll say that there are some quicker ways to get there. I don't know if there's a political will to get there, but we are hoping that we are, we're creating a stage basically, and creating a space where we are working to get to bigger or I will say more answers for racial equity as Chief Equity Officer. So this isn't a one and done kind of formula, right, for racial equity. And I hope that other jurisdictions or other places who are looking at racial equity really understand and see that.
Yes, thank you very much for that important reminder. Like, this is work that we all need to be doing. And with that in mind, I wanted to ask, as someone who's part of the research community, and Urban Institute does a lot of research, do you see any role for research in supporting and helping this work that you're doing? And are there important questions that you'd like to see research help answer? And I'll just open that up to whoever would like to chime in.
Yeah, I think, of course, I think the work and the research of Urban Institute, of the Institute for Policy Studies, of all the other many of the think tanks, and we're so very rich with those in this region, really helps us, one, to say, here are the disparities, right? We know and feel them, right, and every day, and particularly if you are like me and a Black woman as this lived experience. But I think to the greater population, people oftentimes live in their bubbles, right, and don't really know how other folks are living. I think it was just Black Women's Equal Pay Day recently, and I just thought about how important it was that it was on a national news station. That I know that this, is the statistic, but how many people know and care about this, right? How many people know and acknowledge this? And then how can we, as we are, working in our local area, bring this to the attention of our jurisdictions, and then, quite frankly, make policy decisions or process decisions to make sure that we are not continue to perpetuate this for our particular very small part of the world, right, in Montgomery County. How are we tackling this? So I think research does a really good job. I think Institute for Policy Studies had a report that talked about how long it would take for Black families to get to close the wealth gap, right, with our white families. And as much as I knew about that, I think the time period absolutely even blew me away, right? And so I just had to stop and think about how the cumulative effect of divestment from communities and from people, and then how much we as a society has actually really paid the price for that. When we don't invest in folks, everybody loses, whether we feel that or not. So there's always lots of information right now. I can't bring front of mind what I'd like to have research on, but let me think about that, Peter. Maybe I can send you an email.
You have my contact info, so you can just let me know.
Yeah.
But thank you. Any other thoughts on that question?
I completely agree with what Tiffany said. I'm a recovering academic, so I definitely appreciate research and evidence, but I also have been simmering on what Carla said as well around, the process-oriented nature and balancing that with outcome-focused measures. And the performance measures that we're going to be looking at the district level will be more starting with process-oriented measures. I think that's critical. I don't have a specific research question that I want to throw out there. I think we need greater will to look at the current evidence and research and make change. Like, the evidence is clear, as we saw before the pandemic, as we're seeing now. So it's not just having the evidence, but what are you doing with it? How is that promoting change and promoting racially equitable strategies, and also building on what Carla said around white dominant culture around sort of what we consider knowledge. So that's what I would charge Urban Institute and other researchers to really look at, is methodologies that we uphold as gold standards, and is that really just critically examining that, applying a racial equity lens to our current methodologies, and how that could, what are the unintended consequences of that?
Yes, absolutely. Thank you very much for that. Let me ask one last question, and then we're going to turn to the audience questions. I'm going to direct this to Carla Bruce, because it's specifically about the COG committee that you all are part of, and that Carla chairs. So what role will the council play in the work that you're all doing across the region, as well as your own efforts in your respective communities? So what role does the Chief Equity Officer Council playing and will play in the future?
Yeah, so I'll speak as the inaugural chair of the COG's Chief Equity Officers Committee, but also as the first local government Chief Equity Officer in the region. And it's been so helpful to have colleagues in this work, because these are very lonely jobs. We work with a bunch of colleagues, but again, that bureaucrativist sort of role that we play is unique in government. And so having the ability to connect across the region, to share insights, to think about how we might be able to leverage our resources to make sure that we are, again, there's some uniqueness in the role of the Chief Equity Officer, but bringing some definition in some structure to that role, I think is a really important part of, or the outcome of this committee. But I also am hopeful that over time, we'll begin to understand these issues in the way that they really exist, not within strict jurisdictional boundaries, right? We live in a region, and we work in a region, and people cross boundaries every day. And in my fear, I know we were just talking about how we're going to measure success and the use of, racial equity impact assessments, and all of that is important. But what one jurisdiction does really does impact what other jurisdictions will experience. And so I'm hopeful that this, having this committee will provide an opportunity for us to, speak to the regional drivers of inequity and begin to foster some collective action and some collective solutions, and hopefully a regional racial equity agenda. Again, we have there's commonality in our role, but there are also commonalities in how inequity is experienced and what's driving it across the region.
Great, thank you very much. Well, let me turn to some of the audience questions now to try to get to as many of those as we can. And their first one is asking specifically about technology and how inequity is baked into many of our systems, including technology. Much of our data analysis is based on data sets that use technology or algorithms that may be biased. So are you all thinking about any of those types of issues, of how you are thinking about debiasing technology or information? Are you designing tools that are more equitable so that residents can have better access to information? Any thoughts about that?
I will say that one of the other aspects of being a chief equity officer is learning a lot about things that you didn't know about. And my background is in human services and in community engagement. But one of the issues that we are seeing is, we spoke a little bit about it earlier, digital access, but also the fact that one of the key industries of our area is around technology. And so while we haven't, sort of looked at it in terms of sort of biases within technology, I know that, there are businesses in this area who are engaged in that business. And so I always think about what an important role we play as the DMV, right? Because there are so many people from a policy who are influencing policy from a federal government perspective, and who are supporting the federal government. And they are the people in our neighborhoods, right? They are the people that we can potentially engage and help to build their understanding and build their will. And so again, that's not something that we're particularly focused on, but do acknowledge that that's a major industry in this area. And there could be opportunity there. So if the audience member has any particular ideas, I would really be interested in hearing them.
Great, thank you very much. Another question we got is how are you and your teams partnering with philanthropy? And the second part of the question was, how can we support your efforts? So I think it's from somebody in philanthropy. So this maybe is an opportunity to make some requests. But what role do you see philanthropy playing in the work that you're doing?
I think I'll talk a little bit. I will say that the philanthropic world really played a key role to helping see the racial equity work in Montgomery County. As we started to think about this and the resolution started to, as council members started to think about the resolution, we actually got an offer from folks from the Consumer Health Foundation to go through a training. And it was a GARE training. GARE is the Government Alliance on Race and Equity. And my boss at the time, who was a council member, now county executive, Mark Elridge, attended, as well as others in local government. And we knew like instantly that this was a network that we wanted to be a part of. And so we started to strategize about how we were going to join this work. And then myself and my colleague, who's Dr. Elaine Bonner-Tompkins, who also is key to this work in Montgomery County, talked about how we were going to get training to our elected officials, how we were going to get buy-in. And we got some seed money from the philanthropic world to pay for the Racial Equity Institute training, which is a 2-day training on the history of racialized policy in the US, and really kind of lit a fire underneath of our full council. And then the wheels start to turn just a little bit more. So our partnership with philanthropy has been really essential to starting this work and hopefully to continuing this work. There are all kinds of budget constraints in this work. And then there's some creative stuff that we would like to do that's not necessarily, I would say, that we have not yet kind of vetted, but we can kind of play with outside of our everyday budgets. And so I have a couple of ideas about what we can do around kind of oral history projects in our county. And so hopefully we can get some philanthropic help around that and maybe other creative projects for our department.
Yeah, I would agree. The philanthropic community has been very interested and engaged in our work in Fairfax County and has supported us in a few ways that I think are important to share. One is to help us get upstream, right? Again, we are very much focused on the operational and the transactional aspects, but to help us to think about how to do things different. And they've done that by investing in partnership opportunities and perhaps not investing directly in the government, but to provide funding to some of our community partners that are enabling us to do things to get engaged in things that we might not have been able to fund on our own. We too have benefited from the Consumer Health Foundation, and one of the things that they're doing is supporting us as a network of chief equity officers. And I think that's critical, just recognizing the value of these roles and the difficulty associated with these roles and ensuring that we remain strong as we continue to do this work. But I think philanthropy is getting engaged and I think can be more engaged. And I really do think that it's important that we recognize that, no one particular sector has the solutions. We have to work together collectively, and that really the role of chief equity officers represents an opportunity to cooperate with government. I think sometimes those outside of government from the nonprofit and philanthropic sector very understandably have had to work against government, right? And so see us, as working against what their mission is. But I think these roles that we are in are really an opportunity to change systems, to not just deliver programs, but to change how things are operating. And so I'm hopeful that philanthropy sees that as an opportunity and makes investments, because I think that ultimately will be able to leverage and expand the impact of their dollars.
Great, thank you very much. It seems like we have some folks joining us today who are not from the DMV, and so they're very interested in how they might effectively root for creating equity officers in their communities, and also wanting to understand like how widespread this is across the U.S. So, do you have any thoughts about how other places maybe can get equity officers in their communities if they don't have one already?
You want to take that one, Carla, or should I?
We clearly have opinions and experience. I'll start, and how about you pick up?
Sure.
One of the things I will say is that the first step in an equity journey is not to have a chief equity officer. I think that having solid leadership commitment to advancing equity, and in particular racial equity, is important. And as Tiffany said before, it's one element of a broader strategy, but it is not the whole strategy. And so I know that, many people have decided that that's the thing that they will do to demonstrate their commitment to equity. But if it's not coupled with firm leadership commitment to advance this work, it really is, I think, a futile effort. So I would offer beginning to engage leadership in getting their support, in helping them to understand the significance of inequity in a community and the role a chief equity officer could play in terms of devising strategy and planning and building infrastructure. But starting with the chief equity officer, I would not recommend as a first step.
I agree. I think I'll say that probably 18 months before I was appointed, we went through a whole series of what we call community conversations. We went through trainings with our senior staff. These community conversations were around race and racism and around inequities in Montgomery County. And so we conducted these for residents in the county to talk about the prospect of a legislation, what they thought a legislation should include, what their experiences were with race and racism, what the legislation should tackle and make a priority. And we did that for a whole 18 months before we actually created this position. And quite frankly, it probably could have gone longer, right? As I came onto my position, really, I understood the task that I had was to really do that within the government. Because while we had talked about racial equity and the chief equity officer position to our residents to get buy-in, we really hadn't talked about it in detail to employees. And so I spent a good amount of my first 6 months in the county just defining racial equity and what the difference between racial equity and equity is and why we were leading with race. Like it's still a campaign as we normalize this word. So I think there's a saying I saw that the soil is as important as the seed. Right. And so the fact of the matter is racial equity work is change work. It is absolutely change work. And it's really important that if you think you want this to take, that you really till the soil, that you really work within the processes and the systems that you have now to identify some of the barriers, some of the obstacles, so that your chief equity officer can be successful, right? You're not going to be able to tear down all of those obstacles or challenges, but I can tell you that the more you till that soil, the more likely that your initiative and that your department and your chief equity officer will actually be successful in bringing forth hopefully the kinds of outcomes the community is looking for.
And the Government Alliance on Race and Equity is a good resource for communities who are beginning this work. And again, it's a vast network at this point. Probably, I think there are well over 300 communities with different stories about how they began their journey. But I think that as an organization, they're a great resource.
Great, thank you. Thank you so much. Well, I so much wish we had more time because there's so much more we need to discuss. But I'm afraid that's all we can do for today. So we'll just have to have you back another time to continue this conversation. But I really want to thank our panelists today, Carla Bruce, Amber Hewitt, and Tiffany Ward, for the incredible work that they're doing on behalf of their communities, but really on behalf of all of us in our region. And I want to also thank all of you who joined us today. This was the 6th and final event in our series on revitalizing and reimagining the DMV after COVID-19. But Urban Institute will be continuing to stay engaged to provide opportunities for these kinds of discussions. So I hope you'll join us in the future as well. Please fill out the survey if you haven't done so before you leave. And thank you all again. Thank our panelists for today, and please enjoy the rest of your evening.